Did you know that nearly 40% of adults over 65 take 5 or more medications daily? While these prescriptions are meant to help, sometimes they quietly introduce new problems instead. It's a statistic that should make us all pause, because behind every pill is a complex interaction with an aging body, and not all of them are friendly. Let's be honest, aging isn't for the faint of heart. As the years roll on, most seniors deal with a growing list of aches, conditions, and chronic issues. Doctors prescribe medications to manage these symptoms, and in many cases, they're lifesavers. But what's less often discussed are the hidden dangers, the side effects, drug interactions, and long-term consequences that can sneak up and impact your quality of life without warning. This video is for those who want to stay sharp, stay safe, and stay in control of their health. It's not about fear, it's about knowledge. It's about understanding that even something as simple as an over-the-counter pill can create a ripple effect, especially in an aging body. And it's about knowing what questions to ask, what signs to watch for, and when to push back if something doesn't feel right. Here's a common misconception. If the doctor prescribed it, it must be safe. And while doctors have your best interest at heart, the truth is they can't predict how every drug will affect every patient. Seniors metabolize medications differently. The kidneys, liver, and digestive systems slow down with age, which means drugs stay in the body longer and can build up to dangerous level 7 when taken as directed. Let's explore what that looks like. Take sleep aids, for instance. Many older adults struggle with insomnia, and medications like benzodiazepines or over-the-counter antihistamines seem like quick solutions. But these pills can cause grogginess, confusion, and increase the risk of falls. In fact, seniors on sedatives are significantly more likely to end up in the ER with a hip fracture or head injury. Then there are anticholinergics, a group of drugs often used for bladder control, allergies, or depression. They seem harmless on the surface, but studies show they can impair memory, contribute to cognitive decline, and in some cases, even mimic the early symptoms of dementia. And yet, they're still widely prescribed. Another quiet culprit? Proton pump inhibitors, or PPIs, like omeprazole or lansoprazole, used to treat acid reflux. These are often intended for short-term use but end up being taken for years. Long-term use can lead to nutrient deficiencies, increased risk of fractures, and even kidney disease. And let's not forget blood thinners. Absolutely vital for many heart patients, but also a double-edged sword. Seniors are especially vulnerable to bleeding complications, and something as small as a bump on the arm can turn into a severe bruise or worse. Interactions with other drugs, like certain painkillers or supplements, can amplify these effects, sometimes silently. The bigger issue? Polypharmacy. This is when a person takes multiple medications at once, often prescribed by different doctors who may not communicate with each other. The more medications you take, the higher the chance of dangerous interactions. Symptoms like dizziness, fatigue, or confusion might not be aging. They might be a sign of drug toxicity. But here's the silver lining: you are not powerless. It starts with awareness. The moment you recognize that your medications might be causing more harm than good is the moment you begin to take back control. It's not about stopping medications, never do that without a doctor's guidance, but about starting a conversation, about reviewing your prescriptions regularly, about asking, do I still need this? Is there a safer alternative? Are these side effects normal? And there are real stories, real people who've made these changes and experienced a transformation. There's Helen, 76, from Oregon. She was on 10 medications and felt like she was in a fog every day. Her hands shook, her memory slipped, and she had trouble standing. After talking with her pharmacist and doctor, she reduced her medications to 6. Within weeks, the fog lifted. Her energy returned. She began painting again, something she hadn't done in years. Stories like Helen's aren't rare. They happen every day. But they begin with awareness, and more importantly, with the courage to ask questions. So, What can you do right now? Start by making a complete list of every medication you take, including over-the-counter drugs and supplements. Bring that list to your doctor or pharmacist and ask for a medication review. You'd be surprised how often adjustments can be made to improve safety and quality of life. If something feels off, if you've noticed changes in your energy, mood, memory, or mobility, don't assume it's just aging. It might be the result of a drug interaction or side effect. You deserve to feel clear, stable, and strong. We're not saying medications are bad. Many are miracles of modern science. But they're tools, and like any tool, they need to be used wisely, especially in bodies that have seen more than a few seasons. As we continue, we'll dive deeper into which medications carry the greatest risks, what natural or lifestyle-based alternatives might offer relief, and how to talk to healthcare providers to ensure you're getting what you truly need. Nothing more, nothing less. And if you've found this helpful so far, take a moment to like this video, subscribe to Golden Daily Life, and share it with someone you care about. You never know who might need to hear this today. Let's keep going. The most overlooked part of medication safety isn't just what's in the bottle, it's how those medications interact with each other and with your daily life. Seniors are often juggling prescriptions for blood pressure, cholesterol, diabetes, arthritis, and more, each one affecting the body in different ways, and sometimes clashing with the others in ways even doctors may not anticipate. Let's break it down simply. Imagine your body is like a well-tuned orchestra. Every system, your heart, liver, kidneys, brainies, playing its part. When one system starts to fall out of sync, medication can step in like a conductor to restore order. But what happens when there are too many conductors at once, each trying to lead a different section? That's when you get disharmony. A pill for blood pressure might lower your energy. A pain reliever might upset your stomach. A diuretic may dehydrate you and make you dizzy. And when these effects pile up, it's easy to mistake them for signs of aging. In truth, they're red flags. Nowhere is this more apparent than in the area of cognitive health. Some medications directly interfere with the brain's neurotransmitters, which regulate mood, memory, and focus. For example, older antihistamines like diphenhydramine, commonly found in sleep aids, can cross the blood-brain barrier and disrupt your ability to think clearly. Some seniors find themselves suddenly forgetful or confused, thinking they're developing dementia when it's really their medication talking. Then there's blood sugar management. Medications like insulin and sulfonylureas are essential for many seniors with diabetes. But if not carefully monitored, they can cause hypoglycemia, dangerously low blood sugar levels that may result in confusion, dizziness, or fainting. It's one of the leading causes of ER visits among older adults. And let's not forget painkillers. Opioids like oxycodone or hydrocodone are sometimes prescribed after surgery or for chronic pain, but they come with serious risks: dependency, constipation, sedation, and a significant fall risk. Even non-opioid options like NSAIDs, ibuprofen, or naproxen can increase the risk of stomach bleeding or kidney problems in seniors. What makes this even more complex is that side effects often don't show up right away. Sometimes they take weeks or months to emerge, making it harder to trace them back to the drug. That's why routine check-ins with a doctor aren't just helpful, they're essential. But they need to be the right kind of check-ins, ones that focus not just on whether your numbers look good, but whether you feel good. It's time to reframe the conversation around medication. Instead of asking, "What can I take for this?" let's start asking, "What's the safest way to manage this?" Maybe it's a prescription, but maybe it's also a lifestyle change, a natural remedy, or a dose adjustment. Take statins, for example, drugs prescribed to lower cholesterol. They're incredibly effective, but in some people, they cause muscle pain, fatigue, or even memory issues. Yet many seniors stay on them for years without realizing there might be alternatives or that the dose could be reduced. Sometimes a combination of diet, exercise, and smaller medication doses can do the same job with fewer side effects. Or look at diuretics, often used to treat high blood pressure and heart failure. They help the body shed excess fluid, but they also cause electrolyte imbalances, frequent urination, and dehydration. If you're feeling lightheaded when you stand or are constantly tired, that little pill might be the hidden reason. There's also a category of medications called antipsychotics, which are sometimes used to manage agitation in seniors with dementia. But these drugs carry a black box warning from the FDA, meaning they can significantly increase the risk of death in elderly patients. And yet, they're still used in long-term care facilities, often without proper discussion or consent. This isn't about laying blame, it's about raising awareness. The medical system is complex, and no one has all the answers. But what seniors do have is experience, intuition, and the right to ask questions. If something feels wrong, it probably is. So what steps can you take today? First, do a medication inventory. Gather every pill, supplement, and vitamin you take and write them down. Include the dosage, frequency, and why you're taking it. You'd be surprised how many people are unsure what half their pills are actually for. Next, ask your doctor for a comprehensive medication review. Some clinics even offer this as a special service through pharmacists or geriatric care teams. The goal isn't to cut out necessary medication, it's to eliminate anything redundant, outdated, or dangerous. Also, speak up about any new symptoms you experience, no matter how small they seem. Dry mouth, dizziness, memory slips, vision changes, irritability, all of these could be clues that a drug isn't agreeing with you. It helps to keep a daily journal of how you feel after taking your meds. Are you more tired in the afternoon? Feeling foggy after breakfast? These patterns matter, and they can offer clues that doctors might miss during a quick visit. And remember, medication safety doesn't stop at prescription drugs. Herbal supplements and vitamins can interact with medications too. For example, St. John's wort can reduce the effectiveness of antidepressants. Grapefruit juice can interfere with statins. Even something as innocent as calcium can block absorption of certain medications if not taken at the right time. In the next section, we'll explore inspiring real-life examples of seniors who questioned their medication regimens, worked closely with healthcare providers, and dramatically improved their health, energy, and clarity simply by becoming more aware and asking the right questions. Before we go on, if this message resonates with you, consider subscribing to Golden Daily Life. It's a community built for older adults who want to live well, stay sharp, and age with purpose. And don't forget to like and share this video. Someone you love might be quietly struggling with the same issue and not even know it. Let's turn the page now to the stories that truly matter, real seniors who took back control of their health by paying attention to what their medications were doing to them. Take Marie, 73, from Oregon. For years, she had been on a long list of medications: a statin for cholesterol, 2 drugs for blood pressure, something for heartburn, and a mild antidepressant. She thought the constant fatigue, brain fog, and dry mouth were just part of getting older. But during a routine visit, a new doctor reviewed her list and raised some concerns. Turns out, her cholesterol had been stable for years and didn't need such a high statin dose. Her heartburn medication was known to cause long-term nutrient deficiencies, and her antidepressant was likely amplifying her tiredness. With a careful plan and monitoring, her doctor helped her reduce some dosages and stop others altogether. Within weeks, Marie's energy returned, her thinking became clearer, and even her sleep improved. The most powerful part? Marie realized she hadn't been old and tired, she'd been over-medicated. Then there's Franklin, 78, a retired firefighter from Florida. He was on 3 different medications to manage his blood pressure, which had always been high despite treatment. One night, he fainted in the bathroom. After a hospital visit, doctors discovered that the combination of medications had caused his pressure to drop too low, especially at night. Franklin began working with a specialist who focused on timing when he took his medications. They adjusted not just the doses, but the times he took them, avoiding the late-night drop in pressure. The change was subtle but life-changing. No more dizzy spells, no more nighttime emergencies, and his confidence in his own body returned. What these stories show is something every senior should know. You are not stuck. Your medications are not carved in stone. With the right support, you can work with your doctor to find a regimen that works for you, not against you. But these transformations don't happen by chance, they happen by design. It starts with awareness, followed by action. So what practical steps can you take if you're concerned about your own medication risks? Start by simplifying. The more medications you're on, the more likely they are to interact. Ask your doctor, is this medication still necessary? Some drugs were meant to be temporary, but end up being taken for years. Others were prescribed to offset the side effects of another what's often called a prescribing cascade. Breaking that cycle could reduce your overall medication load. Be especially cautious with medications known to affect balance, memory, or alertness. For example, drugs like benzodiazepines, such as Valium or Xanax, even when taken for sleep or anxiety, can raise the risk of falls and confusion. Sleeping pills, often considered harmless, are among the leading contributors to hospitalizations in seniors. Also, check your vision and mobility. If you're on medication that makes you feel dizzy or unsteady, that's not just an annoyance, it's a fall hazard. Falls are the #1 cause of injury-related death in older adults. If something you're taking is making your legs feel like jelly, don't wait, speak up. Then there's the issue of kidney and liver function. These organs are responsible for filtering and processing medications. As we age, their efficiency naturally declines, meaning drugs may stay in the body longer and build up to harmful levels. Seniors often need lower doses, not higher ones, and routine blood work is key to tracking how your organs are handling the load. Another practical tool is to bring a family member or friend to your doctor's appointments. They can listen, ask questions, and help you remember what was said. It's easy to feel overwhelmed or rushed during a visit, especially when discussing something as technical as medication safety. Having a second pair of ears makes a difference. Also, make use of your pharmacist. These professionals are often underutilized, but highly trained in medication management. Ask them, are there any risks with this medication for someone my age? Or, could this interact with what I'm already taking? Many pharmacies even offer full medication reviews for free. And don't underestimate natural remedies, but don't assume they're risk-free either. Turmeric, for example, can reduce inflammation but may thin the blood. Ginkgo biloba, used for memory, can interact with blood thinners. Always run supplements by your doctor or pharmacist, especially if you're already on medication. Finally, remember that you know your body best. If something feels wrong, even if a lab test looks fine, keep asking questions. If your memory has changed, if your mood feels dull, if you're not yourself, speak up. The goal of medication is to support a better life, not to mask it. The next and final part will walk through how seniors can build safer medication habits going forward and how to have more empowering, transparent conversations with doctors and caregivers. You'll also hear one more story that will stick with you long after the video ends. If this information has been valuable to you so far, we hope you'll like the video, subscribe to Golden Daily Life, and share it with someone else who might benefit. You never know who needs a reminder that aging doesn't mean silence, especially when it comes to your health. Imagine waking up each day feeling clear-minded, steady on your feet, and truly present, not fogged up by medications you never questioned. That vision isn't just possible, it's happening right now for many seniors who decided to ask better questions about their prescriptions. Let's talk about how you can do the same, starting today. First, if you haven't already, create a complete list of every medication and supplement you take, prescription or over-the-counter. This includes vitamins, herbal teas, and even that occasional aspirin. Sometimes the things we forget to mention are the most important. Bring that list to every medical appointment. And more importantly, ask your doctor to review it thoroughly, at least once a year, ideally more often. Next, know your rights. You are allowed to ask, "Do I still need this?" Or, "Is there a safer alternative?" Too often, medications are prescribed during moments of urgency, hospital stays, flare-ups, emotional lows, but they quietly remain long after the original reason has passed. If you don't feel better with the medication, then you deserve a plan to review it. Another step you can take is asking about deprescribing. This isn't a word many people are familiar with, but it simply means the careful process of reducing or stopping medications that may no longer be helping or may be causing harm. It's not something you do alone, and it doesn't happen overnight, but it can completely change how you feel. And then there's the role of monitoring. Keep a simple journal of how you feel day to day. Write down any new symptoms, side effects, or changes in energy. This record is gold during appointments. It's often the key to spotting patterns like that new pill that started just before your headaches did, or the morning dizziness that began after a dosage change. Also, try to see one primary doctor or a coordinated care team that knows your full history. When different doctors prescribe medications without communicating, it's easy to get overlapping drugs or dangerous combinations. One senior I spoke to had 4 doctors and was taking 3 different types of medications for the same condition, none of which were working well together. Once her care was coordinated, she cut back to one medication and felt dramatically better within a month. Now, I want to share a story that I think truly brings all of this together. It's about Peter, 76, a widower from Michigan. For years, Peter was on a cocktail of drugs, painkillers for his back, a sleeping pill, blood pressure medication, and something for mild depression. He barely left the house anymore. His daughter noticed he wasn't himself, he was drowsy, forgetful, and had lost interest in things he used to love. After insisting on a comprehensive medication review with a geriatric specialist, they uncovered a cascade of overprescribing. The sleeping pill was amplifying the depression. The painkillers were causing fatigue. His blood pressure meds were too strong for his activity level. Over a few months, they adjusted everything. Peter didn't just improve, he came alive again. He picked up gardening, started volunteering, and even began dating again. His story isn't a miracle, it's a matter of listening, adjusting, and believing that health can improve at any age. That's the message we want every viewer to take away. It's never too late to revisit your treatment. The goal isn't to throw out medications. It's to make sure each one is serving you, not slowing you down. Let's recap the key takeaways. Always know what you're taking and why. Be honest with your doctors about how you're feeling. Watch for red flags like dizziness, memory issues, or fatigue. Don't accept feeling off, as a normal part of aging. It could be the medication, not the years. And most importantly, know that your voice matters in every medical conversation. If you're watching this and nodding along, thinking of your own medication list or a loved one's snow is the time to act. Talk to your doctor. Make a list. Ask questions. Share this video with someone you care about. Let them know that getting older doesn't mean giving up control, it means taking it back. And if this video helped you feel a little more confident, a little more informed, or a little more hopeful, please take a moment to subscribe to Golden Daily Life. Our channel is here to empower seniors and their families with knowledge that truly matters. Like the video, share your story in the comments, and let's grow a community where aging means living wisely, not quietly. Your journey is yours to steer. Let your health reflect the strength and wisdom you've earned over the years.